Chapter 6, Part 2, the senses, specifically looking at the eyes and the ears. And we're going to focus here on section 604 and 605. So looking at diagnostics and pathology as far as treatments of the eye. So now that we understand a little bit of the anatomy of the eye and the ear, and we are more familiar with the medical terms related to some of those anatomical structures, let's look at some of the more common diagnoses and pathologies that can go wrong with the eye. So here's an example of pink eye, okay, conjunctiva or conjunctivitis, that inflammation of that conjunctive membrane. And if you've ever had pink eye, if you've had children, you've definitely had pink eye in your house. You see that yellow crustiness here and that inflammation of that conjunctival membrane. When we look at the ear, you can have impacted cerumen, impacted earwax, infection of the outer ear, which is otitis externa. So externa meaning that outer external ear. And you can have other issues related to hearing loss, imbalances of your equilibrium, known as vertigo. Okay. So when aphakia here, or aphakia, is the absence of a lens, whether they've had to take it out or other damaged conditions when it does not exist in the eye. Here you have blepharitis, inflammation of that, in this case, the lower eyelid. Cataract, this is what our case study is on or in this chapter. This is that cloudiness or the opaqueness of the lens. So we're going to look at our case study here in a second and how your patient suffered from that. Conjunctivitis, we've talked about. Corneal abrasion, this is where you get a scrape or a scratch on your cornea. It can be very painful due to some kind of impact with the sclera or the cornea, or something going wrong with your contact lenses. Okay. Oculopathy, any real kind of eye disease. So kind of a generic term here, pathy meaning disease, oculo meaning eye. Most of these are pretty straightforward once you know the word parts. Acoustic neuroma here. This is a tumor that is, remember that suffix oma can mean swelling or tumor. And in this case, it means a tumor of the auditory nerve here. Cerumen impaction we talked about. Conductive hearing loss. This is due to sound not getting to the inner ear. So it could be some type of blockage. Okay. Laryngitis. This is inflammation of the eardrum. We talked about otitis externa and otitis media. And a sensory hearing loss. This is due to hearing loss due to something with the nerve. So where you have conductive hearing loss, this is where the nerves are working just fine. The sound wave just cannot get to the middle ear or inner ear. And with a sensorineural hearing loss, that's where the sound waves are getting there, but the sound cannot be interpreted. Okay, so it has to do with the inner ear and the nerves related to the inner ear. And as always, your learning outcomes. Then we have section 6.5. Okay, this is looking at treatments. So we have a lot of advanced treatments now for the eyes and the ears. We are able to, with the help of robotics, we can do much more precise cutting. So sclerotomies are much better. They've come a long way in donor corneas and corneal transplants and things related to the eye. And also, they're getting a lot better at catching eye diseases now earlier. And the diseases that can cause damage to the eye, such as diabetes, we're doing a lot better as a whole in catching some of those diseases earlier. So I mentioned earlier here where you have tubes that can drain this fluid. This is the tympanic membrane here. These are your tympanostomy tubes here. Tympano meaning eardrum, ostomy meaning a cut into to remove fluid. So a tympanoplasty is the incision that's made, or a tympanotomy is the incision that's made, excuse me, for the tympanostomy here. Right. So blepharoplasty we've spoken about already. Um, when you look at this intraocular lens implant here, this is a new lens inside of the eye to oftentimes replace a lens that has cataract, iridotomy, cutting into or surgically removing the iris. Here you have a keratoplasty. This is a surgical reconstruction of the cornea itself, okay, due to diseases that can affect the cornea. Okay, retinopexy, surgical fixation of the retina. Ooh, due to a detached retina. Yes. My father actually suffered from this and almost went blind, but they caught it early. It's where not exactly sure what caused it or can cause it, but oftentimes it's due to this intraocular pressure here that is decreased, this vitreous fluid here within the um, posterior segment of the eye can become weak and the retina can droop down. And that's no bueno. That is not good because if the retina is not attached here to the choroid, that part of the retina dies and it can lead to blindness. So, pretty serious stuff. Mm, Miotic here, drugs that can cause that contraction of the pupil due to being able to, oftentimes it is done on purpose to dilate the pupil to be able to look into the retina. Cochlear implants here. This is a miraculous device that can stimulate the cochlea and give sound back to people who are deaf. Very interesting technology there. Laryngoplasties, we've talked about laryngotomies. Okay, pretty straightforward there. Again, once you learn the word parts, so make sure you're familiar with those. Here's another example of a tympanostomy that we spoke about before. And then your learning exercises for 6.5, make sure you do those. Your electronic record here is a patient who suffered from a cataract, went in for a cataract extraction, okay, as you see here, and had issues. So cataract extraction, post-cataract extraction, ophthalmitis, discharge, console note, infectious disease. So what happened? She had um, inflammation here. Let's go back. So cataract, that's the clouding of the lens. She had endophthalmitis here. This is an infection or a cloudiness of the fluid of the eye. So they went in and did an extra capsular cataract, which means they remove part of the anterior surface of the lens and leave the posterior surface with a Paco emulsification. And this is just the method. I believe they use ultrasound. I'm not exactly sure, but it's a way of removing, okay, that portion of the lens and implanting a intraocular lens instead. And a vitreectomy, that term vitreous means that fluid of the eye, they surgically removed part of that fluid that was infected up here. All right, and let's see what went on here. Her complete blood count. Okay. Vitreous culture. Ooh, she's uh, growing bacteria in that culture. No retinal detachment. That's good. History of present illness. She went to the eye doctor with complaints of leukocoria. So some kind of discharge. Her Nystagmus here, involuntary eye movement, and not able to focus. She had a cataract. She was treated surgically with cataract extraction and that lens implantation we saw earlier. She was admitted to the hospital for observation on post-op day 2. She had eye pain, ophthalmalgia. So she was noted, oh, and she had a fever. Okay, and that makes sense with growing this bacteria here. She had a conjunctival infection with edema, so swelling. So she had post-operative endophthalmitis. So a vitrectomy to remove some of that fluid under sterile conditions. They sent it to the lab, and it was intravitreal antibiotics, or she was given, excuse me, intra meaning within, okay, the eye antibiotics, and her fever came down, her blood count improved, but she's still positive for staph. Infectious disease department was consulted, and they put her on some pretty heavy IV therapy, and a PICC line was placed due to needing more stringent antibiotics to try to get rid of that bacterial infection. So you see here intravenous of Vanco via a PICC line. So pretty serious. Ophthalmology outpatient clinic in 2 days, infectious disease clinic in 1 week. So um, So a PICC line was placed and she was discharged home with care instructions. So a very good case study here to kind of sum up our chapter 6 study of the medical terms related to the eyes and the ears. And lastly, make sure you go over your glossary of roots here, all of the terms for chapter 6, your combining forms, your suffixes, your prefixes, your word roots, and your medical abbreviations related to the diseases we spoke about of the eye and the ear. We didn't really mention LASIX, but this is the correcting of that vision issues we talked about, hyperopia and myopia. The medical abbreviation for each eye. So you have ocular dexter here, which means your right eye, ocular sinister, which is your left eye, and ocular utricae, which is both eyes. Don't think we went over that one. Yeah, ear, nose, and throat we did. Eye, ear, nose, and throat. Yeah, the rest of these I believe we did. Okay, so email me if you need me. Chapter 6, the eyes and the ears.